Colleagues, I'm going to take just a minute to thank the members for what I believe has been a very productive work period. Our bipartisan efforts on organ transplants, thank you very much, Senator Grassley, have really paid off. We're going to have new contracting practices with much more accountability to protect the millions of Americans who depend on these organ transplants. Senator Cardin and Senator Daines yesterday focused on dental care. Senator Crapo and both sides are working to build on our mental health work. I thought we had a very good and bipartisan housing hearing that proceeded in the middle of the work period. In my state, 8 different school districts are having to buy houses to rent to teachers because there's such a housing shortage. And then finally, yesterday, the investigation, a 2-year investigation by the Finance Committee, exposed massive federal tax evasion by Credit Suisse, working with ultra-wealthy Americans, often dual citizens, who are hiding their taxes, concealing their tax obligations for years on end. So colleagues, thanks, and it was a productive time. This morning, we're going to continue our longstanding efforts to lower the cost of health care for taxpayers and patients. Today, the committee focuses on pharmacy benefit managers, in particular the new strategies like charging administrative fees tied to the price of a drug that these multi-billion-dollar corporations have aggressively adopted in the last 4 years since we had previously looked at PBMs. Pharmacy benefit managers had a strong case for themselves back in the 1980s and 1990s. The original goal was to use their access to limited data to negotiate lower drug prices on behalf of their citizens, on behalf of their clients, insurance companies, and employers. When prescription drug coverage came to Medicare with Part D in the 2000s, PBMs shifted into overdrive to get to a larger market and more sophisticated drugs. In recent years, it's been increasingly apparent that PBMs are using their data, their market power, and their know-how to keep prices high and pad their profits instead of sharing the benefits of the prices they negotiate with consumers in the Medicare program. I believe this is an industry that is going in the wrong direction, and that's having a big impact on the prices that Americans pay at pharmacy counters from one end of the country to another. There are especially serious consequences for the federal health programs that the Finance Committee oversees. Between Medicare, Medicaid, CHIP, and the individual health insurance market, the committee oversees health coverage for more than half of all Americans, or roughly 180 million people. Prescription spending for these Americans constitutes a significant portion of the amount the United States as a whole spends on pharmaceuticals each year. That totals $577 billion in 2021. That's why it's so critical for the committee to examine what needs to be done to modernize the rules of the road for PBMs. Senator Crapo and I have talked about this at some length, particularly on this concept of modernizing the rules, because what made sense really 30, 40 years ago doesn't look so sensible today. And so we're taking off on this hearing, as with so many of the things that I just outlined over this work period, with strong bipartisan interest, and I thank Senator Crapo for that. So what we're going to have to do is look at pharmacy benefit managers with a thorough eye and take any legislative steps necessary to ensure taxpayers and patients aren't getting a raw deal. The Finance Committee has a long history of tackling these big league issues on a bipartisan basis, and the results speak for themselves. Finally, before I turn it over to Senator Crapo, I want to illustrate just one example of PBM practices that's resulting in high prices. In a competitive market, if 2 products have equal quality, a business should prefer the lower cost option. However, oftentimes PBMs charge administrative fees to drug makers, which are calculated as a percentage of a drug list price. That means PBMs get a higher payment if they favor higher cost drugs. In my view, that's a clear example of these bizarre, these perverse incentives that PBMs have created that has left so many Americans fed up and outraged at the healthcare system. And the consequences of this out-of-whack market are felt by taxpayers and families every time they show up at the prescription counter. Discounts negotiated by PBMs play an important role in driving down premiums for seniors. But the games PBMs play behind the scenes also appear to be driving up drug costs for many seniors who are forced to pay top dollar for their prescriptions at the pharmacy counter while PBMs profit at their expense. So we've got an important opportunity today to look at the latest practices, the most current practices being employed by pharmacy benefit managers, and the impact that these tactics have on taxpayers and Americans who count on affordable medicine for a decent quality of life. Thanks to all our witnesses. Senator Crapo, please, and I thank you for your cooperation.